Hey guys, we're here to talk about lungs failure. And what are the signs having a lungs failure? If you experience persistent signs that your lungs might be in trouble, it's crucial to pay attention to these potential indicators. Number 1. Shortness of breath. Especially during activities that previously didn't cause discomfort, could signal respiratory issues. Shortness of breath, or dyspnea, in the context of lung failure, often results from the impaired ability of the lungs to efficiently exchange oxygen and carbon dioxide. When the lungs fail to effectively oxygenate the blood or remove carbon dioxide, various factors contribute to the sensation of breathlessness. One common cause is the decreased elasticity of lung tissue, making it harder to expand and contract during breathing. Additionally, conditions such as chronic obstructive pulmonary disease, COPD, pulmonary fibrosis, or pneumonia can lead to inflammation, scarring, and reduced airway function, further impeding the respiratory process. In lung failure, the alveoli, tiny air sacs responsible for gas exchange, may be damaged, leading to decreased surface area for oxygen transfer. This compromises the efficiency of oxygen uptake and contributes to the feeling of not getting enough air. The increased effort required to breathe can lead to respiratory muscle fatigue, exacerbating the sensation of breathlessness. Furthermore, fluid accumulation in the lungs, a condition known as pulmonary edema, is another potential consequence of lung failure. This fluid restricts the air spaces and hampers the exchange of gases, making breathing even more challenging. It's crucial to recognize that shortness of breath can be a serious symptom requiring prompt medical attention. If you or someone else experiences persistent or worsening breathlessness, seeking immediate medical evaluation is essential to identify the underlying cause and initiate appropriate treatment. Number 2. Chronic coughing, particularly if accompanied by mucus production or blood, warrants attention. Chronic coughing as a result of lung failure is often associated with underlying respiratory conditions that compromise the normal function of the lungs. One common cause is chronic bronchitis, a type of chronic obstructive pulmonary disease, COPD, where persistent inflammation of the bronchial tubes leads to increased production of mucus. This excess mucus can trigger a persistent cough as the body attempts to clear the airways. In cases of lung failure, the chronic irritation and inflammation of the airways can result in a cough that lasts for an extended period. Conditions such as pulmonary fibrosis, lung infections, or asthma can also contribute to persistent coughing by causing airway constriction, inflammation, or scarring. Coughing may be a protective mechanism aimed at expelling irritants or excess mucus from the respiratory system. However, when the underlying cause of lung failure persists, the cough can become chronic and, in some cases, lead to complications such as fatigue, disrupted sleep, and even rib fractures due to the strain on the chest muscles. It's important to note that a chronic cough should not be ignored, especially if accompanied by other respiratory symptoms. Seeking medical attention is crucial for a thorough evaluation to determine the underlying cause of the cough and to initiate appropriate treatment to address both the symptoms and the underlying lung condition. Number 3. Wheezing or a whistling sound when breathing may indicate narrowing airways. Wheezing or a whistling sound during breathing is a characteristic sign that the airways are narrowed, which can be indicative of lung failure or underlying respiratory issues. This sound occurs when air is forced through constricted or partially blocked passages in the respiratory system. In the context of lung failure, several conditions can contribute to narrowed airways. One common cause is asthma, where inflammation and increased sensitivity of the airways lead to their narrowing. Chronic obstructive pulmonary disease, COPD, which includes conditions like chronic bronchitis and emphysema, can result in persistent narrowing of the airways due to inflammation and structural changes. In cases of acute respiratory distress or failure, conditions such as pneumonia, pulmonary edema, or bronchiolitis can cause a sudden onset of wheezing due to the rapid constriction of air passages. The wheezing sound itself is produced as air tries to pass through the narrowed or obstructed airways, causing turbulence. This audible signal of compromised airflow is an important clinical marker, prompting medical professionals to investigate the underlying cause. It's essential to recognize wheezing as a potential red flag for respiratory distress. If you experience wheezing or hear someone else wheezing, especially if accompanied by other respiratory symptoms like shortness of breath, seeking prompt medical attention is crucial for a comprehensive evaluation and appropriate intervention to address the underlying lung condition. Number 4. Chest pain or tightness, particularly when breathing deeply, may be indicative of underlying lung problems or respiratory distress. This symptom often suggests involvement of the pleura, the thin lining around the lungs and inside the chest cavity, or it could be related to conditions affecting the lung tissue itself. One possible cause is pleuritis, inflammation of the pleura, which can occur due to infections, autoimmune disorders, or other inflammatory conditions. In pleuritis, pain is often exacerbated by deep breaths or coughing, as these movements cause increased friction between the inflamed layers of the pleura. Lung-related causes of chest pain might include conditions like pneumonia, where inflammation and infection within the lung tissue can lead to discomfort during breathing. Additionally, pulmonary embolism, a blockage in the pulmonary arteries, can cause chest pain and tightness, particularly with deep breaths. In cases of chronic lung diseases like interstitial lung disease or lung cancer, chest pain may also manifest, especially as these conditions progress and affect the surrounding structures. While not all chest pain is directly linked to lung problems, any persistent or severe chest discomfort, especially when associated with breathing, warrants prompt medical attention. It is crucial to differentiate between various potential causes and ensure timely diagnosis and appropriate management of any underlying respiratory issues. If you experience chest pain, seeking medical evaluation is essential to rule out serious conditions and receive appropriate care. Number 5. Changes in the color of your fingertips or lips, such as a bluish tint, may suggest inadequate oxygenation. Changes in the color of your fingertips or lips, particularly a bluish tint known as cyanosis, can be a concerning sign that the body is not receiving enough oxygen. In the context of lung failure, inadequate oxygenation is often the result of compromised gas exchange in the lungs, leading to lower levels of oxygen in the bloodstream. Cyanosis occurs when there is a higher concentration of deoxygenated blood, which appears bluish under the skin. In lung failure, conditions such as chronic bronchitis, emphysema, pneumonia, or pulmonary edema can contribute to reduced oxygen uptake or impaired oxygen transfer from the lungs to the bloodstream. The bluish discoloration is most noticeable in areas with thinner skin, such as the fingertips and lips, where blood vessels are closer to the surface. Cyanosis is a critical indicator of respiratory distress and should prompt immediate medical attention. In severe cases of lung failure or respiratory failure, systemic oxygen levels can drop significantly, leading to widespread cyanosis affecting other areas of the body. Prompt intervention is crucial to address the underlying lung condition and improve oxygenation, as prolonged inadequate oxygen supply can have serious consequences for organ function and overall health. If you observe a bluish tint in your fingertips or lips, especially when accompanied by other respiratory symptoms like shortness of breath or persistent coughing, seek emergency medical care to determine the cause and initiate appropriate treatment. Number 6. Unexplained weight loss coupled with respiratory symptoms should prompt investigation, as it could be indicative of underlying lung issues, potentially signaling a serious health concern. Diagnostic tests, including imaging studies, pulmonary function tests, and laboratory assessments, may be performed to identify respiratory issues and associated. If you notice a decline in exercise tolerance or find yourself avoiding physical activities due to breathing difficulties, consult a healthcare professional promptly. Remember, early detection and intervention are key in addressing potential lung problems. Thanks for watching, guys.